Hello, my name is Parita and I'm a PA student. Today I'm going to be performing a musculoskeletal exam on you. I'm going to examine the patient's gait while the patient walks into the examination room. Then I'm going to start by inspecting the patient's hip. I'm going to look for any asymmetry, any atrophy, any bruises. Then I'm going to start by palpating the patient's hip. I'm going to I'm going to have the patient cross their leg over to the other side and locate the anterior superior iliac spine and palpate inward towards the pubic symphysis through the inguinal ligament. Do the same on the other side. Cross the leg over, palpate inward towards the pubic symphysis through the inguinal ligament. And then I'm also gonna palpate the patient's vein, artery, nerve, and the inguinal lymph node. I'm going to do the same on the other side. Palpate the patient's nerve, artery, vein, and inguinal lymph nodes. Then I'm going to have my patient turn to their side and rotate the anterior superior iliac spine and palpate until I find the posterior superior iliac spine. I'm also going to palpate the patient's sciatic nerve. I'm going to do the same on the other side. Have the patient turn over to the side, find the anterior superior iliac spine, and palpate until I find the patient's posterior superior iliac spine, and palpate the sciatic nerve. Okay, so now that I'm done with that, I'm also going to palpate the patient's greater trochanter on both sides. Okay, now I'm going to examine the patient's range of motion. I'm going to start with flexion. I'm going to have the patient flex their legs at the hip joint on both sides. I'm going to perform extension by having the patient slide over to the side of the table and perform extension on both sides, on both legs. Then I'm going to examine the patient's abduction and adduction. So what I'm going to do is I'm going to locate the anterior superior iliac spine with one hand and hold the patient's leg with the other. I'm going to abduct the patient's leg, move it away from the midline, adduct it, just crossing the midline. Do the same on the other side. Abduction, adduction. Okay, now that I'm done with that, I'm going to examine the patient's rotations, internal and external rotation. So what I'm going to do is I'm going to flex the patient's leg and bend the patient's leg at 90 degrees and rotate it internally. Rotate the hip joint externally. Do the same on the other side. Rotate it externally. Rotate it internally. Now that I'm done with that, I'm gonna perform a special test on the patient. I will take a measuring tape, locate the anterior superior iliac spine of the patient, and measure it on like midway until the medial malleolus. Do that. Measure the legs on both sides and compare the results to check for symmetry of the length of legs. Now that I'm done with this, I'm gonna have the patient sit up. And with the patient's legs hanging down, and I would palpate the patient's gastroc and soleus, looking for any swelling, any pain. I would also do it on the other side. Now I would examine the patient's legs and feet, and look for any bruises, any scarring, any swelling. Now that I'm done with that, I would palpate the patient's heel, their tarsals, metatarsals, their toes, toe joints, the deltoid ligament, and the 3 ligaments on the side, their lateral and medial, their lateral malleolus, medial malleolus. Do the same on the other side. Palpate their heel bone, medial malleolus, lateral malleolus, their tarsals, metatarsals, toes, toe joints, their sole, deltoid ligament, and the 3 ligaments on the lateral side. I would also palpate the plantar, on the other plantar on the other foot. Okay, so now that I'm done with that, I would ask the patient to dorsiflex their foot, which is ask them to move their foot towards their knee. Do that on the other foot as well. Now I would ask the patient to plantar flex, which would be moving their foot away from the heel. Away from the knee, sorry. The patient would be doing these movements. After that, I would ask the patient to flex their toes, which would be like this, extend their toes, and wiggle their toes. Once I'm done with that, I would hold the patient's foot by their ankle. I would hold the patient's foot by their ankle and like dorsiflex it towards the knee with using the heel. I would do the same on the other foot. Hold the foot by their ankle, and using this the heel bone, dorsiflex the foot towards the knee. So what essentially I'm looking for is any movement of talus. Now what I'm going to do is I'm going to have the patient sit with bending their sit on their knees, and I would have the patient sit on their knee, and I would press against their Achilles tendon, looking for plantar flexion of the foot, which is a negative sign. Do the same on the other foot, on the other leg. Palpate their Achilles tendon, and have the and look for plantar flexion of the patient's foot, which is a negative sign. And that's it.